Everyone deserves to feel confident in their own skin, and an imperfect smile, well, it can really lower one's self-esteem. A+ Dental wants to help you look and feel your best self. So A+ Dental Care aims to provide the dental services that you need at every stage of life, and here to fill us in is Dr. Tim Herman, and we also have Tanya Nelson Crystal. Great to have both of you here. And let's talk about dental implants and what type of situation should someone consider getting them?
Anybody who is missing a tooth or missing all their teeth or potentially maybe missing a tooth should be thinking about dental implants.
Okay, so even if they only have one tooth missing, a dental implant is an option.
Absolutely. If you miss teeth, their teeth can start moving around to fill that space in, creating other issues. And so if we can get a dental implant in there, it preserves the bone because there's bone in our mouth that is there just to hold our teeth in. If you lose teeth, that bone goes away.
Okay, all right, so its job is gone, so then the bone itself just starts to kind of recede or disappear, like you mentioned. Tell us a little more, though, too, because there's more that happens when we start to lose our teeth, something that happens to us physically, right?
Yes, well, you start to, you're obviously losing the bone, so your appearance starts to change. Your ability to eat your food, and so the quality of life goes down. You can't digest your food as well because you're just not chewing as much, so you stop eating food that you need to chew. Lots of different systemic issues go from not having adequate teeth to chew with.
Okay, and tell us about the implant process. How does this work?
Well, so in our office we have an oral surgeon and a periodontist, and we place implants on a daily basis. It's pretty straightforward. It takes about 45 minutes. You could do it at your lunchtime.
Wow.
Really. We just make a small incision. We place a titanium screw, and you can see that up on the viewer. And basically that goes into the bone, and then it heals for about 4 months, and then the general dentist places a crown on top.
Okay, I had no idea that the process itself was actually pretty simple, and then it goes so quickly. Okay, so why should someone consider, though, going to A+ Dental Care when it comes to their implant needs?
Well, one of the things that because we have a comprehensive group practice where we have surgeons that can place those implants, so what we do is a lot of times there'll be the general dentist, the surgeon, and the patient in that room talking about what their options are. And then we come up and say, okay, the patient can make the decision, have all the information to make the decision that they want to do right away, and very likely get scheduled as quickly as they want to get the process started to replace their missing teeth.
Okay, and Tanya, that's your role, right? You're the surgeon.
Yes.
Yeah, and so this is an opportunity then if someone wants to have this procedure done, like you said, it's all in-house.
Yes.
So how brilliant is that they get to know everyone who's going to be a lead role in the part of getting the implant done. And that's really reassuring, too, as someone who's going to have something as big as this happen. Yeah.
I think it's one of the greatest draws for our patients. They just love that we communicate, we discuss, we have meetings. The patient's right there a lot of times, and they're involved in the process of their implant.
Yeah, as they should be, right?
Yeah.
It's their teeth and their smile, right? So very important and very, very convenient that is the option there at A+ Dental Care. Let's go ahead and talk, though, about the different types of implants.
So in restoratively, what we can do is we can replace a single tooth with an implant, with one implant, one tooth. If you're missing multiple teeth, we can do bridges off of a couple implants. We cannot connect an implant to a natural tooth. Biomechanically, it doesn't work. And then if you're missing all your teeth, there's a couple different ways to have a denture that would snap onto implants, or you could even have a fixed bridge that actually screws into those implants and then can only be taken out by your general dentist.
Okay, so there's a number of options there then. Let's break it down a little further then. Can you compare implants to dentures? What are the pros and cons? Is one better than the other?
Yeah, dentures, I mean, there's pressure and tension. So if we put pressure on bone, it dissolves. And that bone that I said is there only to keep your teeth. You put pressure on that, it dissolves faster. And so you age much faster, your bite collapses, your profile changes. And so if we put implants in and support that, we're preserving that bone. So even if you have dentures, then your jaw isn't going to change. And so there's much better. Dentures, only reason they stay in is with suction, and on the bottom, there isn't any suction. So they're very challenging. Lower dentures are very challenging.
Yeah, and that's why there's the products out there that exist to try to all claim to keep them in there just a little bit better than the other, right?
Yes, all the denture adhesives because dentures don't stay in.
Okay, and let's talk about a fixed bridge. What are the pros and cons of that?
Fixed bridges are faster because if you came in and you had a missing tooth, I could prepare your teeth on either side of that for a bridge. But what it means is I have to basically do surgery on the two teeth on the other side of that space, maybe that didn't need surgery on them. And so there's potential problems. You can end up needing root canal therapy, and they're harder to keep clean. Whereas if you put an implant in that spot, you don't affect those teeth on either side of that space, and you keep them nice and healthy, or maybe even virgin teeth. And initially up front, the implant is a little more expensive, but because you don't have to replace it as often, or maybe ever, long term it's going to actually be a lot less cost.
So it's a lot more cost effective and probably better too for your health, like you mentioned, so many different key points. And Tanya, I want to talk about the process again of getting implants installed, because I mean this is very exciting, but it can also be very kind of makes people anxious, right? Because it's a pretty big procedure that's happening. So can you kind of explain to our viewers what the process is like when they walk into A+ Dental? What are the steps that will be taken?
Well, so first we would do a medical evaluation, determine if they're appropriate for an implant. You have to be in fairly good health and have good bone. But even as we kind of progress in our treatment modalities, we do tend to bring in even patients that are older. And the first process is we take an X-ray. We have a CT cone beam. We do a 3D scan on them. And then we evaluate that bone. And then we determine how they would like to do that, whether they go to sleep for it or with just local anesthetic or maybe just an oral sedation. And then we get them numb. We sometimes we just punch a little hole through the tissue, and then we just drill in and put that implant in, kind of like a knee replacement, but a lot easier, or a hip replacement, and then put a little cap on it. And then we wait 4 months while that bone kind of fuses and integrates to the jawbone, or the implant integrates into the jawbone, and then that's when the crown gets placed.
And nice and easy. You make it sound so simple, and I love that. And you'd already kind of mentioned sedation, so there are options based on a person's level of comfort.
Yeah, at A+, we're qualified to do IV sedation and general anesthesia. So you could basically walk in, be put to sleep, and your implant's done, and it's like 5 minutes past.
And boom, that's it. You take a little nap. And then you're that much closer to having the smile that you've always wanted and having the healthy teeth that you've always wanted.
Our surgeons, I just want to add, our surgeons are so skilled at creating bone too, because sometimes patients don't, because they've waited a long time to get their tooth replaced, they've lost a bone. And so, Dr. Crystal is a DDS MD, and Dr. Pida, our surgeons are so skilled at creating bone that they can get implants in places where other people might not be able to.
Oh, wow.
And creating a lot of people placing the implants is kind of the easy part. Make sure you have enough bone for those implants is really the skill that our surgeons really bring.
And obvious, Dr. Crystal really enjoys the ability to be able to provide that type of service to someone who's probably been told, I'm sorry, you can't have this. She's like, nope, sorry.
That's
exactly
right. That's exactly right.
Exactly.
Yes, and then at the end, when you're done and you've been with them for a year following them, and it's just, you build these really cool relationships with patients too, because you're giving them a smile and confidence, and it's life-changing for them.
Yeah, it is very life-changing. And you have a special offer too today.
We do. So for the rest of the summer through the end of August, we're going to go ahead and have $500 off a full implant. So that can save people money to go ahead and hopefully get started so they can have their teeth by the end of the year.
Oh, fantastic. Okay, and where can people go for more information about the implants? What options might be best for them to come in and meet the team?
Yes, the best thing to do is go to our website, aplusdentalcaregroup.com, and you can find out which office is closest to you. And all our doctors are very skilled at doing comprehensive exams and letting you know what your options are.
Wonderful. Thank you both so much.
Yeah, it's nice meeting you.
It's always so fantastic to find out about these options out there, especially for those who feel like that maybe they've come to the end of the road and, oh my goodness, I just have to deal with what I have and there's nothing else out there for me. But when you can present stuff like this, it is life-changing, just like you said, Dr. Crystal. So thank you both so much.
Thank you very much.
Yes,
Thank you.
always such a pleasure. Always a pleasure.
Meeting.
You as well.
This interview involves commercial content. The products and services featured appear as paid advertising.